let's talk about this. The Democrats maybe thought this birth control rule was a shoo-in for them. New polling shows maybe not the case.
Well, it's complicated, but maybe not so clearly beneficial, even among women, as Democrats might have thought. There are two polls that are relevant on this. Let me talk about our own Wall Street Journal NBC News poll. And the tricky thing here is to distinguish between the rule that the Obama administration put in place for all employers, which was basically a rule that says you must provide free of charge contraceptive services, contraceptive drugs for people in your employer insurance plan. If you ask people, do they approve of that rule, in our poll at least, there's clear support for that. Like by 20 points, the general public says, yeah, the government should require that. But then when you say, but should that requirement apply to religious institutions, Catholic institutions like universities and hospitals, and they obviously object to this rule, then all of a sudden the support falls away, and you have, by a small margin, a majority of, or a plurality of Americans who say, no, the government shouldn't require those institutions, those employers to do it. And then interestingly, when you ask the question and you throw in the idea that this would include not just birth control pills, but morning after pills, which is what would be required, then the support falls away even further. Interestingly, among women, which the Democrats have thought would be the one part of the electorate where there was going to be support across the board for this, when you ask about Catholic and religious institutions, women split evenly, 40% favor, 40% oppose. When you throw in the idea of a morning after pill, even women turn against the rule as applied to religious institutions. So it's not a clear political winner even among women for the administration, though they probably realize that, which is why they've tried to de-escalate a little bit the emphasis on this subject.
Interesting, Jerry, because of course we've seen reports recently, that the Obama campaign is going to count on the female vote very heavily in this upcoming election. I wonder what this has done to his approval ratings. Have we seen it notching an impact there?
Well, that's the tricky question, and there's been a lot of buzz about this topic in the last couple of days among propeller heads like me who pay attention to this sort of thing. One of the other poll that's born on this, and the reason there's a lot of speculation about whether this is or isn't having an effect on the president's overall popularity, was a New York Times CBS News poll that came out yesterday that showed the president at a 41% job approval rating, which is exceptionally low for him and much lower than other polls have found it recently, and that most intriguingly found that number was the same among men and women, 41% men, 41% women giving the president a thumbs up on job performance. Normally this president performs much better among women than among men. That would suggest a big drop among support among women, and some conservatives are saying, aha, this is because of the contraception debate and it's not playing well among women. I don't think you can draw that conclusion. In our poll, we found less enthusiasm for this contraception rule than some people thought, as I just said, but we still had the president at a 50% job approval and a big advantage among women. So I think the jury is very much out, and people ought to be careful about drawing conclusions about attitudes on this particular subject of the contraception rule and their conclusions about what it's doing to the president's overall popularity. I think we'll need to wait and see a little bit.
And Jerry, what does this say about how tricky it is for any political candidate right now to navigate this landscape when it comes to contraception? I mean, these new polling numbers show it's okay in one instance, but not okay in another.
Yeah.
How do you possibly embrace policy making when it's just so close like that?
Well, I think it is tricky, you're right, and I think you ought not to be assuming that you can find the right political path. You can also make the argument that Rick Santorum has hurt himself among women by sounding too harsh on this subject. So there's a balance out there somewhere, just in political terms, but it's very hard to find, and I think people shouldn't assume that they know how this is going to play. I think the one thing that you can say is that how this plays politically depends on which party frames the debate. If the Democrats succeed in framing this as a debate not about religious liberty or Catholic institutions, but about women's health and women's right to choose have access to the kind of health that they want, that's a winning argument for Democrats. If Republicans succeed in framing this as a debate about religious liberty and forcing religious institutions to do things that they find morally offensive, that debate is probably a winner for Republicans. So I think the advantage goes to the party that can tell America what this debate is really about, because it's really about very many things at the same time.